success rate we have for patients, particularly in the IVF program, is such that we're in the top 2% nationally. That takes a great deal of effort and teamwork. And I tell my patients, I'd like to be able to say it's because of us doctors, Dr. Young and Dr. Leach and myself, but that wouldn't be true. I say that 80% plus of it is really having an outstanding lab. The laboratory is run by Dr. Louise Plant, and she's been with me for 15 years, and she's just fantastic.
We do the retrieval, we do the injection of the sperm in the eggs when required. We culture the embryos in vitro, so in the incubator, for a few days, and we freeze embryos. So when the patient comes here for an IVF cycle, so she will come here in this room and she will be laying down on this table, and that's for the retrieval of the eggs itself or for the transfer of the embryos a few days later. And everything is by ultrasound guided, and this room is also sterile. For the andrology lab, where we start for the semen analysis, so over there we do the complete thing to look at the semen, what is the volume, the concentration, how many of the sperm are moving, and what do they look like. And we look also if sometimes there's some antibodies that could be attached to the sperm, so that's a different test on its own.
I work with the male specimen. So when the patients come in and drop off a specimen, or collect here for that matter, for a wash for insemination or IVF or semen analysis, antibody testing, or a sperm freeze, I'm the full-time person who works back here that usually does that. Our lab is located right on site, along with all the other offices for the Fertility Center in Grand Rapids, the Grand Rapids office. We're just on the other side of the checkout area, so we're really close. And when patients drop off for inseminations, the husband or the wife can drop it off here, and then we do our wash, and the MAs come and take it, a couple hours later. Feel free to ask us any question. There's no such thing as a stupid question. I know people learn that in school, and it's true here too, because there is so much information, and we can't expect you to remember everything. So it's perfectly fine to call any staff member or us here in the lab if you have any questions. We've heard it all, really. So it's perfectly fine to do that. It might sound weird, and of course it's going to be uncomfortable, but we deal with it every day. So it's we're pretty open here.